Have you ever looked back and realized the signs were there all along, but by the time you noticed, it was too late? For many families, the passing of an elderly loved one feels sudden. One day, they seem fine. Then, in what feels like the blink of an eye, they're gone. But the truth is, death in old age rarely comes without warning. The body sends subtle signals, sometimes months, even a year in advance. The problem? Most people don't recognize them until it's too late. Imagine this: your aging parent or grandparent starts losing weight, but you assume it's just part of getting older. They sleep more, but you think they're just tired. They seem a little confused at times, but you brush it off as forgetfulness. Then one day something happens, a fall, an infection, a sudden hospitalization, and suddenly you're faced with the reality that their time is slipping away faster than you ever expected. You look back and realize the clues were there all along. You just didn't know what to look for. That's exactly why this conversation is so important. Today, we're talking about 5 critical signs that often appear in the year leading up to an elderly person's passing. These aren't just random changes. They are the body's way of preparing for the final transition. If you recognize them early, you have a chance to do something that so many others wish they had. Prepare emotionally, make meaningful memories, and ensure their final stage of life is filled with dignity, comfort, and love. Before we dive into these 5 signs, let's get one thing straight. This is not about fear, it's about knowledge. It's about being present, understanding what's happening, and ensuring that when the time comes, you won't be left with regrets, wishing you had done more, said more, or simply noticed the signs before it was too late. And here's the hard truth: no one likes to talk about this. It's uncomfortable, it's painful, but ignoring it doesn't stop it from happening. What it does do is take away the opportunity to be there in the way your loved one truly needs you. So stay with me until the end, because by understanding these 5 signs, you'll be equipped with the knowledge to support your loved one through their final journey, not just medically, but emotionally and spiritually. And if this is something you're facing right now, know that you're not alone. Many families have walked this path before, and while it's never easy, recognizing these signs early can help you find peace, clarity, and the ability to make every remaining moment count. Let's get started. One of the earliest and most telling signs that an elderly person may be approaching their final year is unintentional weight loss. At first, it may seem subtle: a belt that suddenly needs tightening, clothes that appear looser, or a plate of food that goes untouched more often than before. Families often dismiss these changes as just part of getting older. But the reality is that losing weight without trying is rarely a good sign. When the body begins its final transition, it stops absorbing nutrients as efficiently. Even if your loved one is eating the same amount of food, they may still be losing muscle mass. Over time, this leads to weakness, frailty, and increased vulnerability to illness. Why does this happen? Muscle wasting and metabolic slowdown. As we age, some muscle loss is natural, but rapid weight loss suggests something more serious. The body may be struggling to digest food properly or process protein effectively, leading to muscle breakdown. Less muscle, less strength, which increases the risk of falls, weakens the immune system, and slows healing. Appetite changes. Many elderly individuals lose interest in food, not because they don't want to eat, but because their sense of taste diminishes. Food no longer seems enjoyable, and they start eating much smaller portions. This isn't just a matter of preference, it's a physiological shift. The body, sensing that it's winding down, stops sending strong hunger signals to the brain. Underlying health issues. Weight loss can be a warning sign of serious underlying conditions like cancer, heart failure, kidney disease, advanced dementia. Even if there's no major illness, depression or cognitive decline can also cause decreased appetite and neglecting meals. What can you do? Many families, out of love and concern, try to encourage their elderly loved ones to eat more. They offer favorite meals, high-calorie foods, and protein shakes. But if weight loss continues despite these efforts, the issue isn't just about food. It's about the body preparing for a deeper transition. At this stage, forcing large meals won't help. Instead, focus on comfortable, easy-to-eat meals, soft foods, small portions, and high-protein snacks. Hydration. Dehydration often worsens weight loss. Offer small sips of water, tea, or soup throughout the day. Mealtime environment. Eating in a calm, familiar space can make a difference. Avoid overwhelming noise or distractions. Respect their natural appetite. Instead of pressuring them to eat, encourage small, nourishing bites that they enjoy. When to be concerned. Not every case of weight loss is an immediate cause for alarm, but if your loved one is eating significantly less, feeling weaker, or losing muscle rapidly, it's time to pay attention. This is not just about physical appearance, it's about the body sending a message. Understanding this message now can help you prepare emotionally and practically for what's ahead. Coming to terms with this reality isn't easy, but it allows you to shift focus from trying to fix the problem to providing the best possible. Comfort and care. This is a moment to cherish their presence, their stories, and the time you have left together. Because in the end, it's not about the number of meals they eat. It's about making every remaining moment count. Let's move on to the next sign. Sign number 2, extreme fatigue and weakness. One of the most noticeable yet misunderstood signs that an elderly person may be in their final year is deep, persistent fatigue. This isn't just feeling a little tired after a long day. It's a profound exhaustion that doesn't go away with rest. Even simple tasks like getting out of bed, walking across the room, or holding a conversation can feel overwhelming. At first, you may notice small changes. They start sleeping longer, needing more naps, or becoming less active. But as time passes, their energy levels continue to decline, and what once seemed like normal tiredness turns into something much more serious. Why does this happen? The body is conserving energy. As organ function slows down, the body begins prioritizing essential systems. The heart pumps less efficiently, circulation weakens, and muscles don't receive the oxygen and nutrients they once did. This is why even minor movements like sitting up or shifting positions can feel exhausting. Metabolic slowdown. The body naturally produces and uses energy, but in the final stage of life, it begins redirecting that energy towards survival. Instead of fueling movement or daily activities, the body starts preserving itself, leading to increased sleepiness and decreased activity. Sudden energy drops. One of the most heartbreaking aspects of this process is that energy levels become unpredictable. One moment they may seem relatively fine, talking, sitting up, even smiling. The next, they are completely drained, unable to stay awake or respond. This cycle can be confusing for families who see moments of alertness and assume things are improving, only to watch their loved ones slip back into exhaustion. Extreme fatigue doesn't just affect the body, it impacts the mind and emotions as well. Many seniors, especially those who were once independent, start feeling frustrated that they can no longer do what they used to, embarrassed about needing help with basic tasks, isolated because they don't have the energy to participate in conversations or family gatherings. This can lead them to withdraw from loved ones, not because they don't care, but because they simply don't have the strength to engage. For family members, this can be incredibly difficult to watch. It's easy to assume they're just being lazy or giving up, but the reality is, forcing them to push through exhaustion won't help. What can you do? Instead of encouraging them to try harder or stay active, focus on their comfort and well-being. Respect their limits. If they need more rest, let them rest. Their body is telling them what it needs. Create a peaceful environment, reduce noise, ensure they have a comfortable place to rest, and make daily activities easier for them. Help with small tasks, dressing, eating, or even sitting. Up can be draining. Offer gentle assistance without making them feel helpless. Prioritize quality over quantity. Instead of trying to keep them busy, cherish short, meaningful moments together. When to be concerned. Fatigue is normal in aging, but if your loved one is sleeping most of the day, struggling to move, or no longer engaging with the world around them, it may be a sign that their body is entering its final stage. This is the time to shift focus, from helping them regain strength to making sure their remaining days are peaceful, comfortable, and filled with love. At this stage, presence matters more than anything. Even if they are too tired to respond, simply sitting beside them, holding their hand, or speaking softly can bring them comfort. This is not about fighting against time, it's about cherishing every moment that remains. Now, let's move on to the next sign. Sign number 3, cognitive confusion and emotional withdrawal. One of the most heartbreaking yet common signs that an elderly person may be in their final year is a noticeable decline in mental clarity and emotional engagement. A person who was once sharp, social, and engaged may suddenly seem distant, forgetful, or confused, even in familiar situations. This change often happens gradually, making it easy to dismiss as just old age or natural forgetfulness. But if your loved one begins struggling to follow conversations, forgetting familiar names, or seeming disoriented in their own home, it could be a sign that their body and brain are preparing for the final transition. Why does this happen? Reduced oxygen and blood flow to the brain. Just like any other organ, the brain relies on oxygen and nutrients to function properly. As circulation slows in the final stages of life, the brain doesn't receive the same level of support it once did. This can lead to moments of confusion, memory loss, and difficulty processing thoughts, periods of lucidity and sudden confusion. One of the most challenging aspects for families is the unpredictability of cognitive decline. Your loved one may have moments of complete clarity, recalling memories, recognizing people, even having deep conversations. But then, within hours or even minutes, they may seem completely lost or disconnected. These moments can feel like flickering lights, sometimes bright, sometimes fading, emotional withdrawal and loss of interest. Many elderly individuals nearing the end of life begin to retreat inward. They may speak less or stop responding altogether, lose interest in conversations, TV, or hobbies they once loved, spend long periods simply staring into space or sitting in silence. This isn't because they don't care, it's because their brain no longer processes emotions and interactions the same way. Increased irritability or unusual calmness. Some individuals become more anxious, restless, or easily frustrated as their mental state shifts. Others seem unusually calm, detached, or indifferent to things that used to matter to them. These emotional shifts are not about their personality changing, they are part of the brain's natural decline. What can you do? Watching someone you love become confused, distant, or withdrawn is painful. It feels like losing them before they are actually gone. But there are ways to provide comfort during this stage. Meet them where they are. Instead of correcting their confusion, gently. Go along with their reality. If they think they're in a different time or place, reassure them rather than arguing. Speak softly and slowly. Their brain is working harder to process information. Simple words, gentle tones, and patience help them feel safe. Create a calm, familiar environment. Too much noise, stimulation, or change can increase their confusion. A quiet, peaceful space reduces stress. Use touch and presence. Even if they struggle to communicate, holding their hand, sitting beside them, or offering a comforting touch can bring reassurance. Accept the emotional changes. If they seem withdrawn or uninterested, don't take it personally. Their brain is simply shifting in ways they can't control. When to be concerned? Not all forgetfulness means someone is near the end of life, but if confusion becomes persistent, they stop recognizing familiar faces or they withdraw from everything around them, it's a sign their body and mind are preparing for the final transition. This is the time to focus on connection, presence, and reassurance. Even if they don't always respond, they can still feel your love. Sometimes the most powerful thing you can do is just be there. No expectations, no need for conversation, just your presence, letting them know they are not alone. Let's move on to the next sign. Signs are for frequent infections and slow healing. As the body approaches its final stages, one of the most visible warning signs is a weakened immune system. You may notice that your elderly loved one, who once rarely got sick, now seems to catch every cold, struggle with recurring infections, or take much longer to recover from minor illnesses. Cuts and bruises that used to heal in days now linger for weeks. A simple cold turns into pneumonia. A minor bladder infection turns into something serious. These are not just random health issues. They are signs that the body's natural defense systems are shutting down. Why does this happen? A declining immune system. The immune system is responsible for fighting off infections and repairing the body. As we age, our immune response naturally weakens, but in the final year of life, this decline accelerates significantly. The body stops responding to infections the way it once did, making even minor illnesses more severe and harder to fight off. Slow healing and poor circulation. Wounds that once healed quickly now stay open for long periods or even worsen. Poor blood circulation means that oxygen and nutrients aren't reaching the skin and tissues effectively, making recovery slower than usual. This is why elderly individuals may develop pressure sores, bed sores, if they are lying down for long periods. Frequent and severe infections. Common infections that signal a body in decline include pneumonia, a frequent and often fatal infection in elderly individuals. Urinary tract infections, UTIs, can cause confusion or agitation before other symptoms appear. Skin infections and bed sores, often slow to heal, leading to complications. Oral infections, gums and teeth become more vulnerable due to dry mouth and decreased immune function. Even with antibiotics, these infections may keep coming back or take longer to clear. Silent infections and hidden symptoms. In younger people, infections often come with fevers, body aches, or obvious symptoms. But in elderly individuals, infections can present differently. Instead of fever, they may experience sudden confusion or disorientation. Unexplained fatigue or sleepiness, loss of appetite or weakness. Families often miss these signs because they expect the typical symptoms, but in reality, the infection may already be spreading. What can you do? At this stage, the goal is not just to treat infections, but to provide comfort and prevent unnecessary suffering. Focus on hygiene and prevention. Keep their skin clean and moisturized, change bedding regularly, and help them move to prevent bed sores. Ensure proper hydration. Dehydration makes infections worse. Encourage sips of water, broth, or herbal teas. Recognize early signs. If they seem suddenly more tired, confused, or withdrawn, consider the possibility of an infection, even if they don't have a fever. Consider less aggressive treatment. If antibiotics are no longer effective and repeated hospital visits cause more distress, it may be time to shift toward comfort-focused care. When to be concerned? If your loved one is experiencing frequent infections, slow wound healing, or unusual confusion, it's a sign that their body is struggling to fight back. At this point, pushing for more aggressive treatments may not always be the best option. Instead of focusing on curing every infection, consider focusing on making their remaining days as comfortable as possible, providing warmth, hydration, and emotional support. Because in the end, what matters most isn't fighting off every illness, but ensuring they feel safe, loved, and at peace. Let's move on to the final sign. Sign number 5, changes in breathing and circulation. One of the most telling and often distressing signs that an elderly person may be in their final year is a noticeable change in their breathing patterns and circulation. These shifts can start subtly. Perhaps you notice them breathing more slowly or pausing between breaths, but over time they become more pronounced. Their hands and feet may start feeling cold to the touch, their skin may appear pale or bluish, and their breathing may become irregular. These are not random changes. They are signs that the body is prioritizing vital organs as circulation slows down. Why does this happen? Irregular breathing patterns. As the body prepares for its final transition, the brain sends weaker signals to the lungs, causing breathing to become shallow and unpredictable. One common pattern seen in the final months is Cheyne-Stokes respiration, a cycle where breathing starts slow, then deepens, then slows again before a brief pause. Some individuals may also experience periods of rapid breathing, followed by moments where they stop breathing for several seconds before resuming. Weakened circulation. The heart isn't pumping blood as efficiently, so the body redirects circulation to protect the brain and core organs. This causes cold hands, feet, ears, and nose as blood flow to the extremities decreases. Skin may appear pale, mottled, patchy discoloration, or even slightly bluish due to low oxygen levels. Shortness of breath and fluid buildup. Many elderly individuals experience shortness of breath even when resting, making simple activities like talking, sitting up, or eating exhausting. In some cases, fluid buildup in the lungs causes a persistent cough, wheezing, or a gurgling sound when breathing. These symptoms aren't just discomfort. They indicate that the lungs are struggling to exchange oxygen efficiently. How? This affects daily life. For many families, witnessing these changes can be scary and overwhelming. It's natural to want to help, to encourage deep breaths, or to panic when they pause between breaths. But in many cases, these changes are not reversible. They are part of the body's natural process of shutting down. The goal should shift from trying to fix the problem to making their breathing as comfortable as possible. What can you do? Create a calm and comfortable environment. Keep the room cool and quiet with minimal stress or distractions. Adjust their positioning. Many people struggle to breathe when lying flat, so try propping them up with pillows or having them sit slightly upright. Use gentle hydration. Offer small sips of water or moist swabs to prevent a dry mouth, which can make breathing feel worse. Consider oxygen therapy if prescribed. In some cases, low-dose oxygen can help ease discomfort, but forcing high levels of oxygen is not always beneficial. Understand that breathing changes are natural. It can be distressing to hear irregular breathing, but often they are not in pain. It's simply their body slowing down. When to be concerned? If your loved one's breathing changes significantly, pauses between breaths grow longer, their skin becomes more discolored, or they seem more unresponsive, these are signs that their body is nearing its final transition. This can be one of the hardest moments for families. But understanding these signs can help you focus on providing peace and comfort instead of panic. At this stage, the best thing you can do is simply be present. Hold their hand, speak softly, and create a peaceful environment. They may not always respond, but they can still feel your love. because in the end what matters most is not how much time is left, but how that time is spent. Now, let's move on to the final thoughts. As we come to the end of this conversation, take a moment to reflect on what we've discussed. Significant weight loss, extreme fatigue, cognitive decline, frequent infections, and changes in breathing and circulation. These are not just random occurrences. They are the body's quiet signals that life is transitioning. For many families, recognizing these signs is painful. It's natural to want to fight against them, to push a loved one to eat more, stay active, or regain their strength. But sometimes, the greatest act of love is not in trying to change what's happening, it's in accepting it and being there for them in the way they truly need. It's about shifting our focus from prolonging life to making the life that remains as peaceful, meaningful, and comfortable as possible. If you've seen these signs in someone close to you, know that you are not alone. Many families have walked this path before, and while it is never easy, knowledge can bring clarity, preparation, and most importantly, peace. This is a time to cherish every moment, to hold their hand a little longer, sit with them in silence, listen to their stories, and remind them how deeply they are loved, because in the end, what they will remember is not the meals they couldn't finish or the strength they lost. It's the love, the warmth, and the presence of the people who truly cared. And if you've made it this far, I want to say thank you. This is not an easy conversation to have, but the fact that you're here means you care deeply about your loved ones. Now, I have a request for you. If this message resonated with you, take a moment to share one thing you learned today in the comments below. Your words might help someone else who is struggling with the same questions. And if you found this information helpful, consider subscribing and turning on notifications. We create content like this to support, inform, and guide families through life's most difficult transitions. You are not alone. And as long as love is present, even in the final moments, there is still something beautiful to hold on to. Thank you for watching, and we'll see you in the next video.